Hello everyone, this is Michelle Hay. I'm acupuncturist at Boston IVF. I'm doing an Instagram live today because I wanted to focus on a couple of things. First and foremost, establishing what acupuncture is. Secondly, also, how do you integrate this into your treatment plan? First and foremost, I'm not a medical doctor. If there's any specific, cycle-specific questions that you have, please, I will refer you back to your reproductive endocrinologist or to the team that supports them, the fabulous nursing staff as well. Again, I'm Michelle Hay, one of the acupuncturists. I work at the Waltham Center in Massachusetts. My previous career is that I used to be a respiratory therapist. I worked in a neurosurgical and surgical intensive care and then the emergency room. So clearly I have my Western medical background there as well. I have a master's degree in acupuncture that came from the New England School of Acupuncture, which is now part of MCPHS, the Massachusetts College for Pharmacy out in Worcester. I've been working at Boston IVF since 2006. We participate in acupuncture before and after transfer day cycles. So you may have seen the advertising for that. That's typically referred to as a pre and post acupuncture treatment. So we see you somewhere 30-40 minutes beforehand and then 30-40 minutes afterwards as well. We focus on threefold approach: invigorating blood flow to the uterus and endometrial lining, mitigating spasms and cramps, right, relaxing that uterine muscle wall, helping you feel more calm and more grounded. That is a protocol-based treatment that was done on a previous study. So we very much follow that protocol. However, there are additions and subtractions to that we can add depending on, do you feel terribly nauseous, or a lot of GI stuff, your bowels bother you, you can just feel lousy, very bloated, very full. Completely understand, and we try to treat some of those small things while also focusing on that embryo transfer. The second aspect is treatment that you have from us before you actually even get to your transfer. Now, hold on. Time, money, very real things. If I had, in a perfect world, I would get to see you anywhere from 2 to 3 menstrual periods before you even start your stim medications, including for IUI as well. I would get to treat you beforehand during your regular period, so I would have a good idea of what you are at your baseline without medication involvement. From an acupuncture standpoint, I'll take you whenever I can get you, and I will optimize having you be the best version of yourself to go through if I get a chance to work with you before you have your transfer. On that day, fantastic. If I get a chance to work with you a month before or 2 months before, because your menstrual cycle, right, typically is somewhere between a 25 to 35 day cycle. And I like to work with patients beforehand so that, again, I have a better appreciation for you and where you are. Now, let's speak about the basics of acupuncture. Single-use needles, fully disposable, nothing scary at all. Typically for your first appointment, when you come in for an initial appointment, you would come in, you have a full differential diagnosis done. And what that means is that everyone has to fill out paperwork, right? The health history questionnaire, you fill it out soup to nuts. You come in, sit down on the table, and the acupuncturist who's taking care of you that day will ask you questions from the top of your head to the bottom of your feet. Obviously, your main complaint is my main complaint, which is fertility-based and fertility-focused. But I need to get a better idea of you as an individual. The world of Chinese medicine very much looks at you physically, mentally, and emotionally. And so in order to come up with a differential diagnosis, which means from the world of Chinese medicine, I have this algorithm in my brain, and I ask you a number of different questions about your digestion, your sleeping, how you're feeling, your body temperature, and each one of those things goes into my algorithm, which then comes out at the bottom for a differential diagnosis. And that is what I focus on, and that's what I treat you, in conjunction with knowing and being fully aware of your diagnosis from the world of Western medicine and from all the information that we get in working at Boston IVF from a reproductive endocrinology standpoint. If you come to me and you say, yes, I've been diagnosed with PCOS, or I have a diagnosis of endometriosis, or a reoccurring pregnancy loss, or a number of litany of other things that you can have, we are well versed and aware of what that means. However, we still do a differential diagnosis from the world of Chinese medicine so that we can look at you from both sides of the spectrum. How does it work, right? Everybody asks me that. I can tell you from the world of Chinese medicine that I look at you and I look at signs and symptoms, I look at your physical presentation, I look at your tongue diagnosis, and I treat you accordingly. So that algorithm that I have in my brain and that initial diagnosis that I have also comes with a variety of acupuncture points that I treat you with according to that. However, you're going to ask me how that works from the world of Western medicine. And my answer to you is, it's tricky for me to explain. And I don't even think the world of neurology understands. Acupuncture has been studied in a variety of settings when you're talking about digestive disorders, insomnia, menopausal issues even, especially if I'm sticking on the female vein. It looks at the specific acupuncture points and then, of course, improvement of signs and symptoms and patient plumb just feeling better, right? So there's a number of studies that have been done across the board. We know from looking at functional MRIs, especially for pain management, because that's frankly the one that's been most studied, is that it lights up different parts of the brain. So we know that there is a neurological connection there. We know that there is something from nerve system in your body and then also integration of the brain. Hello, your nervous system, neurological brain, of course. But how specifically that works, I cannot tell you. And the main reason why is because it's not studied enough and it's really complicated. Go do your thing, researchers. And they're the ones that are going to come back to us with a better understanding for how, from a neurological standpoint, that acupuncture can be effective. So I've mentioned pre and post treatment. So on the day of treatment, that is at our Waltham Centre, which we offer 7 days a week. I've also mentioned consistent treatments where you would come in ahead of time before you even start cycling. We would also treat you potentially afterwards as well. Acupuncture is perfectly safe to use throughout all forms of treatment, including pregnancy. A number of times I will treat patients all throughout their pregnancy with a variety of times because there's very few there's like no side effects. There's nothing no contraindications that you have to be concerned about or concerns. It's one of the safest things you can do, especially during time periods of your cycle where you have so many medications that you're on. And perhaps you're having digestive discomfort or you're having insomnia and you're having hot flashes and night sweats. We can treat you for those as well to help you manage your cycle better. I know everyone is focused on, will this help me have a baby? The answer that I give you is that it's a really complicated procedure to get there. I mean, look at all the things that your reproductive endocrinologist speaks to you. And this absolutely can be a piece of the puzzle to help you get to that ultimate goal. But that it is fairly complicated. So unfortunately, I cannot give you a straight up answer of, oh, I know exactly how this works. It's the certain neurological pathway. Again, I'm going to refer back to research. I know that on the day of transfer, and this is clinically proven right from the study that was done umpteen years ago that we've based our protocol on, that we're looking to invigorate blood flow to the uterus and endometrial lining. We're looking to mitigate spasms and cramps. We're looking to help you feel more calm and more grounded, specifically on the day of transfer. To reiterate, we're at the Waltham Centre in Massachusetts. We're there 7 days a week. There's 4 acupuncturists that are there. My name is Michelle Hay. This is my first foray into Instagram, so I will say thank you so much for your kindness and your patience. And I can't believe all these people that have joined that are saying hello to me. You're absolutely fabulous. I have an email account of mhay@bostonivf.com. You can also phone Robin at the front desk of the Wellness Centre, and she will happily answer any questions and help book appointments and do all that other type of good stuff. All right, cheers.